My name is Dr. Stephen Eric Finkelstein, radiation oncologist at Florida Cancer Affiliates, the U.S. Oncology Network. And I am privileged to practice here in Florida. I'm going to give you a talk on updates in radiation oncology, a view from the American College of Radiation Oncology. Now, while I work for FCA as a physician shareholder, my topic today and my comments are on behalf of the American College of Radiation Oncology, or ACRO, of which we are trying to integrate science and technology into patient care. And we have several focused goals to enhance advocacy, education, leadership, and recognition of practices. For those who want to find some more information about us, you can go to www.acro.org. I think everything starts with leadership. And on behalf of our president, Joanne Dragon, who you see here at the top, who is radiation oncologist at Genesis Care in Jacksonville, Florida, she wanted me to, on behalf of ACRO, thank the society for allowing us to speak here today. Our goal is to be the most inclusive, physician-driven organization in radiation oncology, and that is to drive professional and personal development for our members. As you see here on the bottom, we've been fortunate to have members of the profession who've donated their time to be in leadership roles. On the left, we see Eduardo Fernandez, the previous chairman of the board, and standing next to Sheila Rege, who's the current chairman of the board, next to the head of the American Medical Association from our last annual meeting, as well as myself and my colleague and friend, Jason Evstathio, who we both serve as board members and chancellors of the board of the American College of Radiation Oncology. With that, we have numerous structural committees that allow us to fulfill our mission. We have a robust education committee, of which I am fortunate to chair, along with the scientific program committee, of which Jason has chaired now for many years in a robust way. We also have exciting opportunities for residents and new practitioners in the field of radiation oncology. And we also welcome the ability of residents in other specialties if they have an interest in joining. Our accomplishments is we have a membership program we believe is second to none, in encouraging seed grants and research scholarships, volunteer-driven community committee structure, which allows for a member of the field to get involved as much as they want to. Now, as I said, I chair the education committee, and I've been fortunate as the inaugural chair to really establish our goals are to provide cutting-edge educational programming at a reasonable cost to advance education and promote networking. In that structure, we have the education committee, the scientific program committee, which puts on an annual meeting, as you see here on the bottom right, which we were fortunate, even in COVID, to have the largest number of membership attend a meeting in the society's history. Additionally, we put on webinars and podcasts, which bring information to the membership. And when we do that, we try to provide free SAMs, to provide MOC requirements. Additionally, under the leadership of Brian Lally, there's been a creation of additional tracks to build out administrators, creating a business track that ACRO can be involved in to help get people to understand what the individual practices are doing with respect to radiation oncology. And we've tried to create this all in an environment to enhance networking and in a family-friendly venue. We usually do this within one of the years at Orlando, at Disney, to be able to have practicing physicians both get the information they need as well as be able to take their family as well. Now, you can't have a society without talking about advocacy. Dwight Heron, who is our vice president, he is very focused on the practice of improving radiation oncology within government relations and economics, and has had accomplishments with ACRO, working with other societies to create things such as the freeze on 77XXX codes, the alternative payer model, which is a penultimate importance to radiation oncology. For urologists, what that means is there's an alternate payment structure that is coming to the field of radiation oncology this year, which is of prime importance to all involved. And work with insurance companies and ACRO to work on treatment guidelines. For example, in communication with EBICOR, we as a society, as many others, have concerns about prostate and breast hypofractionation treatment guidelines and how they're being brought into our work as community radiation oncologists. As you see here, we were fortunate to work very closely and continue to work to build a very robust relationship with friends at EBICOR. We also want to acknowledge practice excellence and professional success among our membership. We think it's extremely important that practices that do radiation oncology are accredited practices in which they've gone through a process where people have looked at your practice and been able to say, yes, there is quality there, both for the practices and for individuals. We have the most comprehensive and transparent accreditation program, only program to have dedicated administrative review and surveyors with comprehensive physics review. And this allows for a robust and modern virtual medical chart review that eliminates reviewer bias. And we are the first society in the field of radiation oncology to create a distinction in stereotactic radiotherapy. And we've done this in collaboration with partners in the Radiosurgery Society, the RSS. As you can see here, here's a picture of we have our fellow class for the previous year, and we're excited to bring these kind of things to our membership. So why should a practice, whether it be urology, working with radiation oncologists or radiation oncologists in solo practice, undergo accreditation? We believe this improves practice quality by external review and ensures the most up-to-date quality assurance techniques and standards are in place. And it ensures up-to-date policies and documentation and demonstrates quality to patients and referring physicians, as well as payers and hospital systems. With that, I want to say thanks from the American College of Radiation Oncology, speaking as a member of the Board of Chancellors and a member of the society myself. ACRO has had the pleasure of working with urologists and wants to continue to work here with urologists at the highest levels. And we encourage this continued benefit of working with ACRO with members of our community. Thank you again for allowing me to speak here today.